Let's join Mayor John Tory standing by live for us. Good morning to you, Mayor.
Hi, Mel.
I'm surprised. I thought you were going to be wearing something Leafs, but we'll get to that in just a sec.
Yeah.
Let's get first to VaxTO. We have hit, if you could maybe correct me, we're definitely above that 65% for vaccination for one dose.
Yeah.
Do you have more of an exact number on that and where we stand?
Well, I think we're at about 66% or something,
Okay.
but I think the number of doses I'm sure of, which is 2.038 million since we began, doses put into people's arms. Some of those are second, but most are first. And so we've covered well over 65%. And now we're not stopping at any of these particular milestones and patting ourselves on the back. It's a great job by the team that's doing it. And it's a great job, of course, by people coming out. But now we've got to, like anything, when you get through the first 65%, there are 35% left who are people who, for one reason or another, haven't done it yet, and that's what we're focused on now, is to push forward into places where people have a bit of hesitation or where they may not have had the information they needed to get vaccinated.
What is the theory in that 35%? Is it hesitation? Is it people that don't plan to get it at all? Is it that they just need more info? What is the theory behind that number?
It's all of the above. We've actually seen some research that suggests there are a very small number of people who are just against vaccinations. I mean, there's a sort of a very radical group of people you see that just don't believe in vaccinations. They think there's some sort of a plot. But many people are just saying things like, well, the vaccines came on the scene very quickly, and something that came on very quickly like that, we want to be absolutely sure that, they're safe. And so that's part of the job we have to do in making sure we inform people. And, we're almost down to doing it one by one now in different ways through this text where you can text vaccine to a number that I can't tell you out of my head, but it's certainly available on the city's website. We're having these telephone town hall meetings where the doctor, medical officer of health, and myself and Chief Peg will answer questions, and all kinds of things like that that are really meant almost on a one-by-one basis to persuade people. We're even going to have people out knocking on doors saying you should, go downstairs to the pop-up clinic and we can answer your questions on the way down if you have some. So we're down to that now, and it's going to be, a really intensive sprint through to getting to the numbers we need.
I'm curious, we've seen in, say, Ohio and New York, there are various incentives to get people vaccinated. Do you think the city of Toronto would ever get to that point where incentives are being offered?
Anything's possible. I mean, I think we have to watch how we're doing. And it's like in parts of the United States, I think they pay you if you donate blood, which we don't do here. We do that on the kind of the Canadian way, where it's just people step up and help each other. And I think here, this kind of method we're using, where we're going door to door and informing people and getting people to support each other, having trusted people in the community, persuade people they should get vaccinated. I think that's the way we would probably do it. But you don't rule anything out. I mean, we want everybody to get vaccinated, both for their own health, of course, but also so that we can reach the threshold necessary to reopen in the city under Premier Ford's roadmap. So, we haven't really spent any time discussing that, but it's not my place to rule anything out. If we thought it was necessary to get people vaccinated, that's the objective.
Looking to schools, there's such a division here in opinion on whether or not they should return to in-person. And then there's also the conversation, the argument that it should be left up to the medical officers of health, so done on a regional basis. What is your opinion on that?
Well, I mean, I think it is basically a provincial decision, in principle, and you've seen what the provincial medical officer of health had to say. In the case of our medical officer of health, I think she was very fair-minded about it in the absence of having some data put in front of her by the province. She just said, look, we should judge this based on how the health circumstances are at the point in time, which I think we're almost at where we have to decide. And she said that, whatever we do, we have to do it safely. We're just turning a really important corner now with the thresholds we've reached on vaccinations, where we started this morning with the numbers coming down quite nicely. So you want to be very, very careful in anything you do, knowing that all of us as elected officials, health officials, all of us, I think without exception, have said since the beginning that it is a preferable state of affairs for the kids to have the schools open, and for many parents. But for the kids, it's a preferable state of affairs to have them open if you possibly can. And so I think in the case of our medical officer of health, she just, wasn't pressed into answering that question yesterday in front of the media, but rather will carry on discussions with the province and will come to a conclusion that seems right for Toronto, which is her responsibility, and I will support whatever she does. But we've all said from the beginning it's a much preferred state of affairs to have the schools open if that's possible to be done safely. Okay,
we've run out of time for this segment. For 10 seconds, prediction for tonight, Leafs.
Look, I think they're going to prevail. They've got some solid momentum, so I think they're going to prevail. Even though I said it would be Leafs in 6, I think they can do it in 5, so fingers crossed. Big night.
There you go. Okay. You hear the cowbell. That means the gang is ready for you.
I'm sure that's not Sid. His approach is too
it was fully Dina. It was fully Dina. All right, Mayor Tory, there is so much more. It is Tory time.
Let's go.